Hello, I'm Dr. John Sand, a neurologist and an expert on myasthenia gravis. I'm also on the board of the Myasthenia Gravis Association of Kansas City. I have been speaking to you about some medications and treatments for myasthenia gravis, and so far I've talked about mestinon and prednisone, which are sort of the mainstays of the treatment of myasthenia gravis. Certainly those are two of the most common medications used either alone or together for myasthenia gravis. As I talked about earlier, all the other medications I'm going to talk about and treatments all alter the immune system, and that's how we feel that they make myasthenia gravis better. That is, to suppress or somehow control the abnormal antibody that is made in myasthenia gravis that interferes with the chemical communication between the nerve and the muscle. Many of these treatments and virtually all the medications came out of the experience first in the 50s and 60s of cancer chemotherapy, where we knew or found out very quickly that these medications would suppress the immune system. Some of these medications were not strong enough to be cancer chemotherapy agents, but later on were used in disorders of the immune system. Later, as organ transplant became more common, more medications and treatments were used in that area, and it's through that experience that we now have more medications and treatments for the treatment of myasthenia gravis to alter the immune system. These medications include cyclosporin, Cellcept, Imuran, and some other medications that are less commonly used, such as methotrexate and tacrolimus. Many of you have been on these medications, or probably it has been discussed with your physician. Other treatments that are used, as you probably know, are plasma exchange and IV immunoglobulin, or IVIG. And I will be talking about these in the future.